Hello, I'm Dr. Grant Yu. I'm one of the dentists here at Guelph Dental, a clinic that's been serving Burlington for 42 years now. In this particular session, we're going to be discussing what crowns are for and how they're made. So, the first step, obviously, as I think anyone who's ever had any sort of dental procedure done, is the anesthetic. So we're going to go ahead and anesthetize the lower right and the lower left side of Dr. Spady's mouth. And then from here, the next step is we start the preparation. We're going to take about, like I said, 1.5 to 2 millimeters of tooth structure off the top of the tooth, and then we're going to very carefully plane back the sides of this tooth another millimeter. And we're going to work fairly quickly but very precisely, staying away from the adjacent tooth structure and any soft tissue as well. So what the next step is going to entail is us taking an impression. We're going to try to capture a very detailed impression of the lower jaw. We're going to place a small cord, which is effectively a very thick thread, just underneath the gum line. And the reason why we do this is because we want to push the gums back away from the tooth so that when we inject the impression material over this tooth, we'll have a very clean, very accurate, very precise impression of this tooth. In the meantime, while the impression is being sterilized and prepared for shipping, what I'm going to do is we're going to actually make a temporary crown for Dr. Spady. So we have now received the crown back from the lab. Now the next step here is we need to take the temporary off of this tooth. We're going to clean up all the excess cement with the micro etcher, which is effectively, you can think of it like a miniaturized sandblaster, because we want to have a nice fresh tooth surface on which to bond the crown. We're now going to try the crown in, make sure that the color match and the fit is there, and it is. Okay, so the fit's good, the color match is excellent. So the next step, and the last step really here, is we're going to cement it in with a permanent cement. What you'll see now is my assistant placing the bright blue light up against this tooth. This is called a curing light. And the reason why she's doing this is because the cement is light activated or photo activated. And so the bright blue light is actually going to start the process of curing the cement and making it hard. So we're going to flick all the excess cement away. And having done that, we're going to make sure there's nothing left in between the teeth. So we're going to do that with floss. And now my assistant's going to go over again for the final cure, which is going to be about 60 seconds with the same light on each surface of this tooth. So the crown is now in. We're now going to re-inspect the margins to check for any flakes of cement or any sort of discrepancies. And everything looks good, but just to be doubly sure, we're actually going to go over and polish the edges of the crown again. We're going to make sure that that the margins where the porcelain meets the tooth is as close to glassy smooth as humanly possible. So we do our very best to keep them as comfortable as possible, as relaxed as possible, so that when they walk out of here, they spent 60 minutes in here. It's like, oh yeah, I had the procedure done. That was fine, right? I'm a little bit numb, but I wasn't really paying attention to it. That's really the objective here.